I'm Andy Miller, a local community health physician.
Hi, I'm Danette York. I am the Butte County Public Health Director, and I support the mission and goals of Everybody Healthy Body.
I think it is true that we all, and always will, struggle with the community's mental health, both individually and collectively. I think physical activity has been long recognized as a way to help protect and promote mental health. Really what we're talking about is the prevention of mental illness.
Physical activity helps everything. Anytime we can get people and family members out and be active and moving, it can help things like reducing stress, reducing or creating the ability to fight off diseases. And unfortunately, Butte County is not a stranger to trauma. And anytime that we can get people physically active and having fun, it will help with that as well.
In the public health world, there is a concept of health in all policies, which says everything that we look at and every piece of legislation, piece of local ordinance that we look at, we should be considering what are the health impacts of this. And so that includes things like land use. How should we be setting aside our land so that we are supporting health?
The impact is huge for Butte County for this project once it's up and going, because everything that we can convince families and citizens to do that will help them in the long run will also help our community. It will lower all of those indexes that show that we have high heart disease rates and high obesity rates. So everything that we can do to increase those activities, especially if it's free and fun for families, then they will take advantage of them, which will help us as a community.
Having a facility where children and adults can go and be physically active it's an enormous impact. So, as our community grows, and it will, and as the density of our community grows, and it will, out of necessity, setting aside space for people to get outside, out in nature, be physically active is an important priority for our community. And so I think the major hurdle that we have to overcome is realizing that health is important, that it is a part of our collective decision making, and to give ourselves the license and the leeway to use our health as a guiding force in the decisions that we make. So hopefully we can, and hopefully in this case, Everybody Healthy Buddy can be a mechanism by which we prioritize health, and we do that in our policy and our ordinance.